Serious doctors of Reddit, who were your dumbest patients? I'm a nerd document. I once had a 20-year-old and his girlfriend come in at 2 AM freaking out because something had tore his throat open. He seemed fine. No blood. Breathing fine. I had him open his mouth. Saw nothing. So didn't want him to lose confidence in me. Clearly something had happened. So I'm looking and looking. There is nothing wrong with this kid's throat. Finally I say, look, it seems okay. What do you feel or see? I don't feel it, but look, it's right there. Where? Looking. It was his uvula. Somehow this kid had gotten to the age of 20 without ever noticing his uvula. Girlfriend was also horrified. I told them it was normal. Did not believe me. So I told them I was about to blow their minds and showed him his girlfriend's uvula. Minds blown. Another life saved in the air. Had an old coot best possible description of the man who was sweet, but had clearly spent his adult years drinking away whatever brain cells he started with. He presented with a chief complaint of I can't drink beer anymore. Every time I drink one, I just throw it back up a few minutes later. Well. Turns out Cooter hadn't been able to eat actual food in months, was subsisting on pretty much just beer, and hadn't shoot in over 2 weeks. But that didn't bother him a bit. Until he couldn't have the beer. Then it was an emergency. He had a big old tumor blocking the distal part of his left colon, so near the end of the road, intestinally speaking, and everything gradually got backed up all the way to his stomach. That's why he couldn't keep the beer down. There was just no more room at the end. I fixed him with a colostomy, and he got better and left. He refused chemo, and I figured he'd just go home and die of cancer. But then, almost exactly 1 year later, he came back to me with just about the same complaint. Obstructed to the point of not being able to drink beer. Except this time, it was that his ostomy had essentially retracted into his abdomen and the skin had nearly grown shut over it. He was shooting out of a teeny tiny hole in his skin. WTF. Even my oldest partners had never seen anything like it, but once again Cooter wasn't remotely phased. He just wanted us to fix it, so he could go home and keep drinking. I did. Haven't seen Cooter since. I kind of hope he's still out there, treating his cancer with Budweiser and just blissfully ignoring the Grim Reaper. Had a Marine once who came to me complaining over a shoot on his right forearm see 2 weeks. This was his first visit for the issue, and hadn't had anything like this before and was worried, since he reported worsening symptoms since initial onset. When asking about prior skin issues, he told me he had ringworm just prior to this rash. Look at his arm. It looked like a mild second-degree chemical burn in a rather circular shape, with blisters on the edges. What got me was the exact definition in the burn edge. Asking the young LCPL how he got that, he replied, well, that's the burn I got from the bleach I poured on my arm. When I asking him why he poured bleach on his arm, well, how else was I going to kill the ringworm? I was an intern in the I have seen a lot of stupid people. It was a small town and all. The worst, I think, was when I walked in and the floor smelled like, I don't even know. It was by far the worst thing I had ever smelled. I asked a passing nurse what the smell was, and he just shrugged his shoulders and told me someone probably shoot everywhere. Well, the doctor is preparing to go into this room, but I did not expect what would happen next. He opened the door, and I almost barfed. It was extremely hard to keep my professional composure. The guy had his leg wrapped up. The doctor asked him to unwrap it, and it was gangrene. From his foot up to the middle of his thigh. The smell I had been smelling was rotting flesh. The cause, the four-wheeler I was riding, caught fire 6 months ago. We had a patient once on a PCA, a kind of pain medicine pump with a button that the patient pushes to dispense more medicine. She thought she had to physically lick the button in order to get the medicine. It was weird. I had a patient in her 30s complain of monthly rectal bleeding that would last 4 to 6 days and stop on its own. It started when she was 11. She just thought she should get checked out. It did stop for a while when she was pregnant. There was one who was very upset to find out that she was pregnant again because she'd used her diaphragm exactly as she'd been told. She carefully inspected it for holes, applied the spermicide, placed it, wore it at night, then took it out, cleaned it and put it away each morning. and then her husband arrived home from his night shift. There are several close calls. The patient who fixed an appointment for a pedicure the day after open heart surgery. He said that he'd just sneak out of the ICU and that nobody would notice. The patient who had an amputation of half of his foot and decided that it would be a good idea to walk to the toilet after returning to his room, covering the floor in bloody footsteps because the suture ripped open again. The patient who said that he didn't have any previous operations but was basically covered in scars. When asked about each of them, he suddenly remembered having about 15 surgeries for various accidents. The patient who forgot that he had his kidney, spleen, and part of the colon removed because of a tumor. The patient who decided that he'd never take more than 3 pills a day because obviously taking more than 3 pills a day is going to kill you. He was on 4 or 5 different meds at that time and basically just chose at random which meds he was going to take which day. I posted this a while back when a similar question was asked, GP here. The most outrageous thing I've heard was from a boy who was something like 20 to 22 years old. Very poor, illiterate family. The boy had a bad case of tonsillitis and refused to take any meds because all he needed to do was bite the sun. Basically at noon he had to look up to the sun, open his mouth as wide as possible and bite the sun several times so it would burn his tonsils and cure him over the course of a couple weeks. When that wouldn't work, plan B was to do the same at night, but only under a full moon. TL. Doctor, bite the sun and cure you tonsillitis. I worked at the during my internship and met a girl who had increasingly painful and red eyes since a couple of days back. The last 24H had been horrible. I asked about all the normal stuff and she claimed to have no idea why she had this eye problem. She had never had anything wrong with her eyes. I proceed to drop some dye in her eyes to check them in a microscope, and when I do I realize she's wearing contacts. She didn't like her natural eye color, so she had bought a set of blue colored lenses 8 months earlier. Never removed them, not even during nighttime. Didn't even think to mention this to me. Claimed to have no foreign materials in her eyes. Needless to say, I gave her quite the harsh lecture and a referral to an ophthalmologist. We had a patient come in for theater. When asked if she'd followed the fasting instructions she said yes, but luckily the nurse didn't believe her. With some prodding the patient eventually confessed to having 6 chocolate bars and an orange juice for breakfast. Obviously the surgery was delayed. She's lucky to have such a good nurse. We once had a super morbid class obesity woman come in for a routine knee replacement and she blatantly lied about eating not 1, but 2 McDonald's big breakfast meals as well as 3 sausage McMuffins and several MCDS hash browns for breakfast on her way to the hospital, which her family bought her and also withheld that info for some time. She aspirated in, and went into severe ARDS. After 6 weeks on ECMO, yeah, I know. She died. They couldn't even turn her in the bed because she was so unstable. After they removed her body from the room, the mattress underneath her was basically rotted. The only time I have ever seen them throw away an entire hospital bed. Girl came to the for nausea/vomiting. Tried to give her some Zofran. No thanks. I'm not really a medicine type person. My body rejects chemicals. N. Had a patient who was convinced that drinking grape juice with baking soda was helping him fight prostate cancer. But your cancer is actually getting worse. I'm gonna stick with my plan. I really feel like it's helping. Edit. Yes, it is kind of like Steve Jobs. You can all stop replying that now, because we all get it. They put a clock ring on for a week solid. Turned up with a penis like a rare aubergine color and swelling. No way it could be salvaged. Given a full pinectomy as bad as it sounds. Now has a hole between his legs. At least that's the one that sticks in my mind. Edit. Makeshift seek ring. 14-year-old couple. Splitting birth control pills to be extra safe. Girl gets pregnant. Boy gets gynecomastia. I really want to say they're stupid because they are. But at the same time I can't help but wonder if it's because they received some really bad 6th edition. At least they were trying to be safe, which is more than a lot of people can say. Surgical resident here. One that comes to mind while I was on the cardiothoracic service was a gentleman that came in through the trauma bay with a stab wound to the chest. He reported after we fixed the rather large hole in his right ventricle that he was just visiting a friend, and while on the stoop of the building, a random stanger stabbed him with a sword from a first floor window. He proceeds to laugh, get back in his car with his buddies and drive home. Despite the rather profuse bleeding from his chest, he drives home for some period of time and then eventually decides he should go to the hospital. Drives by himself to the hospital. Last thing he remembers was being on the way to the hospital. Lucky bastard was found in the parking lot, had passed out in his car, eventually made it to the OR, and walked away just fine. TLDR. Jackass gets stabbed in the heart, decides to go home and hang out for a while, eventually somehow drives himself to hospital before dying, and without killing someone else on the road. When I was doing rounds in the air for my medic, I encountered this woman. She was in her early 40s and was apparently a frequent flyer for pain meds. Since she had become known in the community, this was a small city in West Michigan, she was no longer able to trick doctors into giving her meds. So what does she do? She pulls out her own teeth. She had tried to do a couple, but they wouldn't come all the way out. She did eventually get one out, but this was after a few attempts. This isn't the stupid part, however. She felt that this may not do the trick. So she waited for a few days knowing she would get an infection and we would have no choice but to give her what she wanted. Well, it didn't work. They gave her NSAIDs and antibiotics. There was the guy whose elderly mother suffered a massive brain hemorrhage, and I had to tell him there was nothing surgically we could do for her. He tearfully told me that he would do anything for his mama, and she could have his brain to save her life. Dude wanted us to do a brain transplant. I had to tell him that no, unfortunately that would not be possible. I have the grandma, the mom, and the teen in the room. The teen is pregnant, but this apparently is a good thing. There are no father/grandfather/boyfriend/jobs in the picture, but everyone decided it was about time a new generation was added to the family lineage. Apparently the teen did not appreciate the fatigue, full bladder, back pain, etc. that go along with being pregnant, and is also experiencing some cramping pains. She demands that we do a C-section because she's tired of being pregnant, even though she's still not far enough along, because then we can just hook up the preemie in an incubator to finish growing, and the government can just pay for the incredibly expensive ICU stay. My jaw just dropped. Then there was the lady wearing short shorts and no underwear who raised her leg and showed me the pus-filled wound on her labia. While in the middle of the waiting room, I don't miss rural ob/gyn experiences. Dentist here. I had a patient a few years ago who could not understand how she had gum disease on her upper teeth. She thought gravity would pull all the bacteria down onto her lower teeth, leaving her top teeth plaque free. Wanna trade dental stories? Had a woman former IVDU who wanted me to take all her teeth out for dentures. When I told her I wasn't going to do that, and that fillings would fix the teeth that didn't have to come out, she said I was an idiot, and that the Amish do it when girls turn 18. Then there are people who try to take their own teeth out with needle nose pliers. Turns out using cement as a DIY cast for your broken but not reset leg is a bad idea. Turns out the chemicals in the cement irritate and dissolve your skin. He became septic and almost died by the time he presented for medical care. Emergency medicine, preventing natural selection one stupid person at a time. I had a patient who came to the emergency department vomiting so much I had to admit him for intravenous fluids. I took the usual history, including what he'd eaten recently, nothing out of the ordinary. A few hours later, he calls me over. Doctor, I did eat some chicken and rice earlier. My girlfriend made it yesterday, and we left it in the pan on top of the stove overnight, and I ate it this afternoon. This was in a July heatwave. Do you think that could have been it? Yes, I do. Size, we had a little talk about food hygiene. During a fellowship in oncology, I had a nurse call me downstairs to discuss a patient. He was on a phase 1 clinical trial and we needed to check trough values to see what his dose limit would be. We started out at 10 mg in the form of 2 5 mg X4 tablets, so his dose could be modified without redispensing. Well, he could not comprehend the amount of pills he needed to take. Just did not understand that he needed to take only 4 every day, and he had a month's supply. We had to physically withhold his medication and have him come to the infusion center every day to take his medication because he would have otherwise overdosed and died. How hard is it to understand you take 4 tablets a day